Mindfulness and cognitive therapy. While some debate the effectiveness of the cognitive part of cognitive behavioral treatment for OCD, the general consensus is that a significant problem for OCD sufferers is how they appraise the significance and relevance of their thoughts. In other words, when you become aware of thoughts that trigger you, you make assumptions about the meaning of those thoughts, and this drives you toward compulsions. Just as it is mindful to sit and know you are sitting, or breathe and know that you are breathing, it is also mindful to think and know that you are thinking. To know that you are thinking means to also know that there is a tone or style to the way in which you think. The untrained mind misses much of this, leaving you to follow OCD's lead when you think about triggering experiences. If you can recognize that you are thinking about a trigger in an unskillful way and challenge yourself to think about it in a more objective or mindful way, this may give you an advantage. We often forget that compulsions are choices we make because we get lost in the kind of thinking that tells us compulsions are something we must do to survive. In this chapter, we will explore problematic ways of thinking common to OCD and the tools you can use to adjust this thinking. Cognitive therapy. During the 1950s, a therapist named Aaron Beck noticed that people had strong emotional responses to certain kinds of thoughts that came up during psychoanalysis. This led to an examination of how thoughts lead to emotions and how emotions influence behavior. Through this process, he developed cognitive therapy, which posited that the faulty or distorted interpretation of a person's experience correlated with her dysfunctional behavior. Certain types of thoughts became correlated with certain responses, and when these thought types could be identified, the responses could be changed. Beck called these thoughts hot cognitions. They're also commonly referred to as automatic thoughts. Beck took the concept of automatic thoughts and developed a list of what are called cognitive distortions. You may also find the term mistaken or faulty, beliefs used interchangeably with cognitive distortions. Cognitive distortions can best be understood as lenses that we put over our thoughts that affect how we view them. They are the mechanisms by which we are derailed from mindfulness and fall victim to automatic thoughts. A thought happens, and rather than experience the thought simply as it is, we push the thought through a lens that distorts it and spits it out as something quite more troubling. Challenging cognitive distortions. Challenging distorted thinking is a delicate process when you use mindfulness to help relieve your OCD. It requires you to pay a level of attention to them that gives thoughts some intrinsic importance. Yet, leaving distorted patterns of thinking unchallenged allows the mind to repeat faulty patterns that lead you to believe that you must act on compulsions. If you can notice when you engage in cognitive distortions, you can identify them as part of the OCD. This doesn't mean that you disown or disassociate from them, but rather that you don't take them so personally. They are your thoughts happening in your head, but they don't define who you are. By using mindfulness to notice what your mind is doing, calling it out, and saying, "I'm doing blank," name of distortion, you simultaneously accept it as it is and challenge it. When you become aware that your mind is engaging in a way of thinking, you open yourself to the opportunity to release that thinking and return to the present. The power of noticing when your thinking is distorted is the crossroad between cognitive therapy and mindfulness. When you challenge a distorted way of thinking, remember that you're challenging the distortion, not the thought itself. In other words, you may have a thought about being dirty. That's the thought you're having. So trying to convince yourself that you are clean will only push you in the direction of washing. However, challenging such notions as, "Because I had a thought about being dirty, I must wash," can free you to make a non-compulsive choice. So the goal is not to prove your fears away, but to demonstrate to your mind that you can be in the presence of your fear without having to respond to it with compulsions. The first step in applying mindfulness to cognitive therapy is practicing being aware of when you engage in one or more cognitive distortions. In the following sections, We will discuss some of these more commonly understood faulty beliefs found in OCD and discuss strategies for challenging them without doing compulsions. We have combined and modified some beliefs to make them more specific to OCD. All or nothing, or black and white, or absolutist, or dichotomous thinking. Seeing things as being one way or the other, with no in-between. The problem. This is the most common distorted lens through which we view our OCD. We live in a world that seems very black and white. Movies have good guys and bad guys. Things are often described as clean or dirty, pure or evil, safe or dangerous, and so on. But this is not the real world. Real life always involves some amount of gray. So if you find yourself thinking, I am dirty because I touched a public doorknob, you allow OCD to run the show by even suggesting that you were clean in the first place. You were probably somewhere in between clean and dirty, and after touching that uncomfortable public item, you were at best somewhat dirtier on one hand than you were before. What are some OCD thoughts that you view as all or nothing issues? The challenge. If your mind is being too black and white, what would be the gray area? How could you say the objective truth that accounts for the fact that it's neither 100% good nor bad? Usually this involves saying something more diplomatic. For example, if you were anxious during a night out, you might think, it was difficult to enjoy myself, instead of, the evening was ruined. Or if you said something that hurt someone's feelings, you might think, I'm unhappy with the choice I made to say that, instead of, I'm a horrible person. Look at the examples you wrote for your all-or-nothing beliefs and see if you can reword them to reflect the more gray reality. Don't worry about getting this right just yet. This is a skill, and like any skill, it's meant to be done poorly before it can be honed. What ideas do you have for challenging your black and white distortions? Catastrophizing, or predicting, or jumping to conclusions. Assuming that a feared scenario will play out in the future and you won't be able to cope with it. The problem. OCD loves catastrophizing because it sets the biggest trap of all, the idea that we can predict the future. We can't predict the future. You may be very bright and really good at guessing, but you are not psychic. OCD tells you that if you don't do your compulsions, you will fall apart, someone will get hurt, the world will end, and your worst fears will come true. The thoughts may present themselves in such a way that you not only think about a horrible future, but you also predict your inability to tolerate or cope with that future. What kind of terrifying predictions does your OCD make? The challenge. If your automatic thoughts start with, I will, or some other prediction, then you can always start with an admission of fact. I can't predict the future. Now, what could you say if you included this fact? Probably something like, this thing may happen, but I don't know for sure. If it does, that could be bad, and I might have to come up with a way of dealing with it. This doesn't mean that your prediction is definitely wrong. Maybe the worst thing you can think of will come to pass. It's okay if that last sentence spiked you a bit. It's hard to accept an idea like that. But in objective reality, you don't know if your fear will come to pass, so behaving as if you do know is just working overtime for the OCD. Rather than trying to convince yourself that your catastrophic fears are guaranteed not to happen, how can you reword your previous catastrophizing examples to reflect an acknowledgement that the future is unknown, or that you lack evidence for your prediction? Magnifying. Taking something as it is and making it bigger. The problem? If you have health anxiety, your freckles seem like moles, and your moles seem like cancerous tumors. If you find yourself aware of bad thoughts, you think they are the worst thoughts anyone has ever had. Every cold seems like a horrible disease, every raised voice seems like an act of violence, and every error in judgment seems like a federal crime. What are some thoughts that run through your head that seem horrendous, but in moments of calm clarity seem like just, well, stuff? The challenge. If you're making a mountain out of a molehill, try to acknowledge that it's a molehill. That doesn't mean it's safe. It just means acknowledging what something is as it is. If your OCD says, that red mark on my shoe is disease-infected blood, you could simply acknowledge that there is a red mark on my shoe and I'm uncomfortable. You're not trying to disprove the OCD. You're just making the case that it doesn't deserve the attention it's getting. How could you describe, in a more observational way, the magnifications in the previous examples you wrote? Discounting or disqualifying the positive. Purposely shutting down or blocking out evidence that your fears are OCD-related. The problem. In cognitive science, the term confirmation bias describes the common human mistake of interpreting evidence in a manner that supports our pre-existing beliefs. We fall into this trap by discounting evidence that opposes our beliefs. When triggered, your entire life experience seems to go out the window, and the only thing you hear is that your fears are true. You may be the most devoted father on earth, but the moment you had a thought about shaking your crying baby, you started sentencing yourself to death for being an abusive father. When your OCD tells you that noticing the beautiful actress on TV means you're unfaithful, you might forget that you've had multiple opportunities to cheat on your spouse, none of which you have chosen to act on. You may also find it practically impossible to take a compliment due to your commitment to shut down compliments because they contradict what you hear in your head all day. Accepting that the evidence in front of you supports that you are probably okay may elude you in an OCD episode. When do you sometimes disregard evidence that contradicts your obsessions? The challenge. Although an experience doesn't necessarily prove anything, you can use it to challenge an assumption. So, if you struggle with sexual orientation OCD, you may be discounting your life experience of being with one kind of person. Challenge this by responding, "In my experience, I have typically chosen to be with this kind of person." Notice how we intentionally resist addressing the orientation itself. We simply state that the claim of the OCD thought isn't supported by historical evidence. What are some ways you can challenge your disqualifying distortions? Emotional reasoning, using feelings as evidence of the veracity of your fears. The problem. As discussed in Chapter 1, feelings aren't facts. Of course, we use our emotions to make sense of reality. It's just that OCD has its thumb firmly placed on the fear button, so we find ourselves thinking that something must be true because it just feels that way. Your upcoming performance feels as if it will be a disaster because you're nervous. You may think you'll be violently attacked because you feel unsafe. Challenging emotional reasoning requires separating having a feeling from the meaning that the feeling may imply. Feeling at risk doesn't place you at risk. Feeling ashamed doesn't make you a person of low worth. What are ways in which you notice yourself thinking that things are true only because they feel that way?